Good day, everyone. You're welcome to Smart Spark Academy. Please, if this is your first time coming across our video, please like, subscribe, share to your friends, and leave a comment to encourage us. Today, we'll be looking at Popliteal Fossa. This is an anatomy topic. It's a very important anatomy topic, and it comes out in most anatomy exams, especially for 200 level, those learning upper and lower limbs. So if this is your point of interest, don't scroll, sit down, get your book and your pen. Let's learn together. We are going to be studying this topic, Popliteal Fossa, using exam marking scheme. I'm not going to make it long. It's going to be brief, straight to the point, for you to get your 10 marks in exam. We have the description, the shape, boundaries, contents, clinicals. Also, don't forget to add diagrams anytime you're answering an anatomy question in an exam or test. We'll start with the description of the popliteal fossa. The popliteal fossa is a fat-filled compartment of the lower limb seen when the knee is flexed, producing a depression. Let me do a rough sketch for you to understand what I'm saying. Now, before I proceed, I want you to understand something. We have anterior in anatomy, we have posterior. Now, this popliteal fossa is found posteriorly at the back. Okay, this is anterior. I'm facing anterior. Now, when I turn back, this is my posterior. The popliteal fossa is found at the back of the leg. You cannot say it's found at the back of the leg in an exam. You say it is found posteriorly. I don't know if you understand. It's found posteriorly. Now, let's look at this rough sketch. Let's look at this rough sketch. This is the posterior aspect of the lower limbs of the leg. Now, back to what I said under my description. The popliteal fossa is a fat-filled compartment at this junction of your knee, like the thigh and the leg. There's a fat-filled compartment here, sorry. Now, this fat-filled compartment that is found when the knee is flexed is called the popliteal fossa. Don't know if you get your knee, at the back of your knee, popliteal fossa. Just understand it that way. It is a depression posterior to the knee when it is flexed. Depression posterior to the knee when it is flexed. That's that on the description. Let's look at the shape. Now, the shape of the popliteal fossa is diamond. It's a diamond-shaped depression. Let's do something here. Remember, I said it is found at the knee joint when it is flexed. This is what the popliteal fossa look like. The popliteal fossa. I want you to understand that this is medial, close to the body. These are medial boundary. These are lateral. Our lateral boundary, it is away from the body. In anatomy, medial is any part close to the body, like midline of the body, middle, median, any part close to the middle of the body. This is the leg. We have our second leg here. So this is the medial. Now lateral is away from the body. So this is the medial. This is lateral. Notice we have two medial boundaries, here and here, here and here. So let's call here superior medial. Superior, it's up. Superior medial and superior lateral. So what then we call here? This is superior, inferior, medial, and inferior lateral. Now with this, we can proceed to what is found superior medial, superior lateral, inferior medial, and inferior lateral. Now with our diagram, we'll look at the boundaries. Remember I said this is superior medial. Now the muscle that is found on this superior medial boundary is a semimembranosus. Semimembranosus, superior medial. See, the way I recapped this for my exam, because this question came out in my first semester 200 level anatomy exam. I remember that superior medial, SM, semimembranosus, SM. Quick recap. Now let's go to superolateral. We have the bicep femoris muscle. So we've got to superomedial, superolateral. Now inferiomedial, medial head of the gastrocnemius. Inferiomedial, medial head of the gastrocnemius, medial. Don't forget gastrocnemius muscle. Then inferiolateral, lateral head. Don't know, just try to get things that will make you remember. Remember lateral head of the same gastrocnemius. This one have the medial head, while this have the lateral head. And don't forget that lateral to this semimembranosus muscle, we have the semitendinosus, just for extra knowledge. Now, the floor or posteriorly, this popliteal fossa is on the skin. It lies on the skin. The floor of the popliteal fossa is the skin. Then what covers it, which is the roof, is the popliteal fascia. Now with this, you've given them boundaries. We've gotten description shape. We've gotten a rough diagram. We also have a very good label diagram on the screen, which you can draw in your exams. And we've given them boundaries. We are getting our 10 marks slowly. Now we'll go on to the content. Now we move to the fourth thing we have, which is the contents. What are found in this popliteal fossa? We have 5 major anatomical structures found in the popliteal fossa. Let's learn it together. Number 1, termination of the medial small saphenous vein. Now this medial small saphenous vein ends in this popliteal fossa. So just remember ends. You cannot use any termination. Termination of the medial small saphenous vein. Number 2, we have the arteries and veins, popliteal arteries and veins, and their branches and tributaries. Now, the veins have their branches and tributaries. The arteries have their branches and tributaries. They are found, veins and arteries are found in popliteal fossa, so we call them popliteal arteries and veins. Then we have the common tibial and fibular nerves. Don't forget that this popliteal fossa is found at the junction between the thigh and the leg. Now, this leg is made up of the tibial bone and the fibular bone. Now, because of this, we have the tibia and fibular nerves. Now, the nerves, these common tibia and fibular nerves, are also found in the popliteal fossa. We have posterior cutaneous nerve of the thigh. The nerve found in the thigh is also found here. We've talked about the nerve found in the leg. Now, we are talking about the nerve found in the thigh. The common tibia and fibular nerves, the posterior cutaneous nerve of the thigh. And lastly, we have the popliteal lymph nodes and lymphatic vessels. So even if you cannot remember everything, remember lymph nodes. We are talking about popliteal, so definitely we'll add popliteal. So remember lymph nodes, remember arteries and veins, remember nerves. With those three, I think you have half of the mark. Now imagine if you can calm down and remember everything as it is here. We are good. Finally, we have the clinicals. Let's look at the clinical importance of this popliteal fossa. Let's look at the clinical importance of the popliteal fossa. The first one we have is the popliteal pulse. Popliteal pulse. The same way we have the radial pulse, the brachial pulse, the femoral pulse. We also have the popliteal pulse. Now it can be found at the back of the leg, posterior to the knee. Now, the popliteal pulse can be palpated when the knee is flexed. Note that. That's the first one. Now, the second one, we have the Baker's or popliteal cysts. When you hear cysts, what comes to your mind is swelling. So it's simply when there's a swelling in this popliteal fossa, when there's fluid retention, Baker's popliteal cyst. Now, the third clinical importance we have here is tibial nerve injury. Don't forget that one of the contents of this popliteal fossa is the tibial nerve. I mentioned the common tibial nerve. Now, there can be an injury to the tibial nerve, maybe during dislocation. I know you've heard, oh, somebody was playing, he fell down and dislocated his knee. Now, there can be a damage to the tibial nerve. It's one of the clinicals of popliteal fossa. And finally, we have the common fibula or peroneal nerve injury. Fibula still means peroneal, so please, I don't want you to be confused. Now, as the fibular nerve is also one of the content of the popliteal fossa, it can be damaged. It can get injured during dislocation, twisting, and all that. So these are some of the clinical importance. I want you to know that we have more. Go read your textbooks, make researches, you find out more and write it. But if you can give just this 4 or 3 in your exams under clinicals, trust me, you're good to go. We've come to the end of this tutorial. I hope you enjoyed it. Please, if you have any question, drop it in the comment sections. Smart Spark is always active and ready to reply to your question. Or if you want us to treat any topic in anatomy, any topic you're finding difficult and confusing, maybe you did not understand where your lecturer was teaching, drop it. Let's do it together. We'll learn together. Don't forget to like, share, subscribe, and drop a comment. Thank you all.